who is stopping it from being prescribed? Like, is there a they out there? Is there someone that's nationally doing it? I mean, obviously the social media companies are shutting things down in a strange coordinated effort. I mean, these companies, it's illegal for them to collude, and yet they all seem to strike at the same time to do this, and yet they probably would never even admit to doing it. I don't think they made an announcement of doing it. They also did it right when they were being summoned by Congress. I mean, one of the congressmen brought it up last night to Facebook, to Zuckerberg. He said, no, that was Twitter. We didn't actually do anything, which was actually a lie because Instagram blocked, PragerU, that had posted that same video of that doctor on the steps of the Supreme Court. But who's actually coordinating the lack of, or it not being prescribed? It's not the CDC, it's not the FDA, or is it?
It's the FDA. It's the FDA who's now said that they've looked at the studies and the side effects far outweigh the benefits. And so therefore, physicians should not be using it for this. And there's no benefit from it from COVID-19 patients. There's no efficacy studies that have shown that this actually blocks the SARS-CoV-2 virus, which is, and again, it's a lie. And then the level up from that, I think it was last night or this morning, Bill Gates came out with another video that said, the big tech companies need to move faster. They need to move faster to shut down all this misinformation about hydroxychloroquine. So I really kind of would like to know, and I don't really know the answer to this, but who's Bill Gates' handler? Who's upstream from him?
Yeah, well, we need to talk about that and maybe educate some people that don't know all the links here. Why would the FDA do this? In your opinion, where does this come from? Does the FDA have vested interests in the vaccine? Do they have people above them that are controlling them? Is it that it's an election year and Pharma is donating to people? Trump has made some posts recently saying Pharma's going after him because he's been lowering drug prices. What do you think is happening here?
The answer to what you just asked me is yes, and yes. So the FDA has long been nothing more than the handmaiden, the signature portion to the pharmaceutical industry. Several years ago, I don't remember exactly what year this is. I'm going to say it's within the last 7 to 8 years. The FDA created a fast tracking program for the pharmaceutical industry, where if they wanted a drug moved to the head of the line in terms of the FDA approval process, they could pay a fee to the FDA to move that drug forward faster. I believe the last time I looked that somewhere around 30%, maybe even more, of the FDA's annual budget comes from these fast track fees that the pharmaceutical industry pays. So there's always money involved with it if you just pull back the curtain and start looking for it. The FDA has always been just a signature sign-off. When they have like CBER meetings or ACIP meetings, which is when the CBER meetings is when they decide that they are going to move forward with the original clinical trials, the animal trials, look safe enough to move forward to the next level of vaccine or drug testing. That's always a sign-off. They're like with hydroxychloroquine, they created this COVID panel, and something like 14 out of 17 of the representatives on this panel were representatives from Gilead Pharmaceuticals, who are trying to make Remdesivir. I can never say that drug right. But they are really trying to make this other drug, this very expensive drug, over top of hydroxychloroquine. So they're shutting all of these things down in every possible way, preventing physicians from prescribing it, preventing patients from getting cured from it. We don't want to make it readily available. We're going to have the FDA tell all the state medical boards that if your doctors are prescribing it, they could be, unless they write into their notes, into their patient's notes, that you have been advised that this drug could kill you, then they would be open to liability and perhaps medical malpractice. I mean, they are like surrounding this on every possible level, particularly coding over the top of it with mainstream media, letting patients know, oh, this drug isn't safe, we shouldn't be taking it, when it's completely safe and it's preventative and curative. But again, it's all because of the fact of the mechanism of action of how this medication works. Actually shuts down the replication process of these viruses, and it makes the vaccines unnecessary. And the machine is moving forward at full tilt to get this vaccine to market in less than 18 months. They've done it under EUA's Emergency Utilization Authority so that they can do it without any liability. They can fast track it past animal studies. They can get it to market in 18 to 24 months when it usually takes at a minimum 5 years. No adequate testing, complete liability protection. And if suddenly a cheap readily available drug comes into their primary markets, which is the US and the EU, and upends their entire vaccination program, no wonder they're coming at this with guns a-blazing.